And welcome back. It's often used to help people that have sleep apnea. We've got Steve Gordon here. He's a respiratory therapist here with Intermountain Healthcare, and here to talk about the ways we can positive airway pressure. What is that?
Well, positive airway pressure is it comes from a machine like this. It's really just kind of basically a blower in a box, but it blows air down a tube into a mask that applies to your face, and it really just creates a little bit of a splint inside of your mouth with air pressure to keep your tongue and soft tissues, the little dangly thing in the back of your throat.
Yeah.
To keep
What's that called?
It's called the uvula.
Uh-huh.
And sometimes when people lay back, it can actually fall back and completely obstruct their airway, and so it keeps it out of the way. So
maybe
breathe.
We should take a reverse a little bit. What is sleep apnea?
Well, sleep apnea is when those soft tissues in your mouth, when you lay down, there's just a little bit of a less drive to take a breath.
So do you actually stop breathing?
Your airway actually collapses, and you want to breathe. You try really hard to breathe, and you just can't get any air past the tongue and all the soft tissue that's blocking your airway.
Now, Steve, how many people do you think suffer from sleep apnea?
It's estimated anywhere from 4 to 7% of the adult population in the United States.
And what kind of things can that affect?
Well, from a personal perspective, it affects how you feel during the day. You're tired, sleepy, just don't feel good. A lot of people, the symptoms early on, people think I'm just getting older because I don't think as well. I feel tired, and so they just don't feel as well. In the long run, it can be associated with a higher incidence of heart attack, with stroke, with some really nasty things in your health.
But Steve, as technology comes along with everything, it makes things a little bit easier and a little bit nicer. And so you've got now technology that people can wear. It's not all over their face, and they can actually get a good night's sleep in it.
Yeah, so historically, some of the things that challenged people were really just the size of the machine and how noisy it was.
Yeah, it's like you're sleeping next to Darth Vader.
Yeah, as opposed to the freight train coming through your
body.
Right.
Yeah, you got to pick your poison. So now the technology makes it a little bit nicer for everybody.
It's quieter for you, quieter for your bed partner. The masks are a lot smaller. They're designed to take less pressure on the face to get a good seal. And so it's a lot more comfortable to be able to use CPAP today than it was even just a few years ago.
Now, do most people's insurance cover something like this, or a test at least, to see if you have sleep apnea?
Most insurances will cover the testing and cover the equipment. But it's important to check with your insurance
before you do.
Before you do, and know what your insurance benefits are.
All right. And so if people have any questions, they can call right now. We've got people standing by. It's 1-877-908-0680, and you guys are going to be there to make sure they're insurance compliance and everything, and be able to help them out with all kinds of good information.
Yes. Well, whenever we get an order, we always want to make sure that we understand what the insurance is going to help the patient with, and make sure the patient understands that before we.
Steve, thank you very much.
Thank you, Casey.
Appreciate it. Let's throw it on over to Debbie. I think she's talking about vacation.